everyone. My name is Samantha Yarwood, and I'm a behavior services consultant for the specialized resource homes within Community Living Toronto. And I'm here with the Learning Together newsletter. And we're here today to speak with Josie, who is a dental hygienist who works with individuals with developmental disabilities. And she actually comes in and works with the individuals that we support within the specialized resource homes. But she also works with other individuals within the field. So, welcome and thank you very much for being here. We're
Thank
really
you.
excited to be able to talk to you.
Thanks for having me.
Of course. Okay, so tell me a little bit about yourself and what you do.
Okay, so I'm an independent registered dental hygienist. And as Samantha mentioned, I do provide in-home dental preventative services. Majority of the patients that I do see do live in congregate living settings, residential programs, or simply known as group homes. That's the majority of the patient base that I do treat. I do treat some individuals in their own private homes, but the bulk of my patient base are in group homes. I have about 13 years dental hygiene experience, and I've been providing these services in home for approximately 3.5 years. Uh, Total dental experience, 16 years combined with some previous experience prior to becoming a dental hygienist.
Well, that's awesome. And this is such a crucial need. We're really fortunate to be able to use you at Community Living Toronto. Um, Tell me a little bit about how you got into the field.
So I started off my dental career path in 2004. I was a dental assistant level 2 at Mount Sinai Hospital. And this is where I got my earliest experience in assisting and treating different patients with various special needs coming from all over of Ontario. They have their dental program there. And so I learned some vast experience at this hospital in treating persons with different, behaviors and medically compromised conditions. Then I eventually went on back to schooling and completed my dental hygiene schooling in 2008. And then it led me eventually to where I am today. Yeah.
Well, that's awesome. We actually use Mount Sinai a lot of the time with the individuals that we support, especially or specifically the adults. They have a good program there, which is something that we use. But as we'll talk about, it's more difficult to sort of make those appointments, and that's why you come in and you're so helpful. What motivated you to do what you wanted to do to get into this field?
So what happened was while I was a dental hygienist, I did for 3 years, I was managing a couple of dental clinics. And these dental clinics provided sleep dentistry to those who could not stay awake for dental treatments such as fillings, extractions, the more invasive stuff requiring needles and drills, and you have to sit still for those procedures. However, I found that many people who needed to be asleep for dental treatment, they did not actually have to be asleep for dental preventative like cleanings.
Right.
And so I realized how many were like that. And then I also got to realize there's so many different group homes in the GTA. A lot of them were bringing their patients there because they were having a hard time getting into the hospital, or they didn't necessarily need to be in a hospital setting to have their treatment. And so that's where my light bulb went off. And I realized that there was a deep gap in the dental industry with the special needs community, especially when it came to preventative care. That's where I got sort of motivated to start what I'm doing now.
Right. And it's so true. It's so often that most individuals have to go under in order to get some dental procedures done. Um, and the preventative work that you do is what is so crucial in, um, basically, alleviating the need for the individual to be put under, which is great. Um, so speaking of which, why do you think it's so important, or why do you think oral hygiene and preventative procedures are so important?
Well, many reasons. But
Yeah,
the main thing is the most obvious dental disease like cavities, gum disease, if left untreated, it can lead to serious negative health outcomes. And in some cases, it can be life threatening. So preventative care is often the initial screening or, the examination part of finding these dental diseases of the mouth or oral diseases of the mouth with the gums too. And so when you find things early, when you're going in for preventative cleaning, it greatly reduces or completely eliminates the need for dental emergency appointments, especially trips to the ER. Given with this current pandemic, the ER is where people really are trying to avoid right now. And so
Yeah.
preventative, even more than ever, it was always important, but I think now it's critical. It's crucial. You need to find things early enough. And the only way to really do that is usually to be screened ahead of time rather than waiting for an emergency to occur. So that's why I believe it's really important.
Yeah, and a lot of the time you see individuals who are nonverbal, unable to sort of communicate pain or whatever it may be, and then I think as we'll talk about it, it's unfortunate because they will often use physical actions that can be really misunderstood, whether that be self-injury or aggression. So um, speaking of which, so what challenges do you run into in this line of work? I'm sure many, but
Yeah. I guess the most common challenges that happen fairly often. First of all, we'll talk about the planning, the logistics of just booking an in-home visit. Sometimes the coordination can be pretty straightforward, and sometimes it's a lengthy process because we do have to collect, like when you go into any clinic, detailed medical history, medications, allergies, health conditions. You have to collect all that information. And a lot of the individuals I do see that live in group homes, they take various medications. They have a few conditions happening at the same time. And so sometimes conditions, there could be a risk with what I am doing when it comes to dental preventative, for example, dental scaling. And so when we do see that there's conditions that are a little bit more complex, more rare, we do have to receive clearance from the physician and usually in writing. And so we have to send a letter and then they respond back in writing if we can proceed with care. So that's one conflict that can happen where it can delay the appointment, or sometimes rarely it'll be a result where we can't treat the person, then it would have to be seen in a hospital setting only. So that's one issue. The second issue that I come across too is when it comes to obtaining consent. As time has gone on, I think in society, we're even with COVID and the vaccines, like consent tends to be an issue with the simplest of procedures. And so because I am doing a procedure in the house, it's not just a quick look. It involves the patient to understand what I'm saying and be able to respond appropriately to show that they understand. And many people they're not capable of consenting for themselves. So they do have a substitute decision maker, family member, public trustee who has to provide the ideally written consent. And so that sometimes can be a challenge too and delays the booking process because I have to get consent from the appropriate person that is to be consenting. The last issue definitely is sometimes the way the treatment date goes when I walk into the home. And so, for example, let's be a little bit more specific. If somebody has ASD, autism spectrum disorder, and especially if they're nonverbal or minimally verbal, and sometimes even with nonverbal, they can understand things. The planning, the preparation is so important for our appointment to be successful. What I find sometimes is if someone has a strict routine daily that they follow from morning until when they go to bed, if they're not prepared to have my visit, they may not want it at all. It may either be a very rocky visit instead of a smooth one, or completely derailed. And so sometimes it takes several visits just for them to get comfortable with me there and touching them and trying to do things.
yeah,
When there's a change in the support staff, which I understand is sometimes unavoidable, but that change, and if it happens frequently, that's where I find I have the most challenge breaking through to the individual to receive the care with minimal to no resistance. Like some resistance is normal at the beginning because it's new, but I find that at times it can just completely start right from the beginning. I've seen people where it's been maybe 2, 3 times and we're getting further and further, but then you see there's some change that happened, in the home. And then I almost feel like I'm starting from scratch again. And so that's where it gets challenging. I've been trying now more often to send pictures so that they can create a social story for this person, but you do need prep. You need a few days to a week to really get them to understand this is going to happen and this is what you're going to see. And so it's challenging, and I've been learning along the way, and everyone is so different. And so that's one of the challenges that I've come across too, is it's the prep, it's the environment. If I walk in and let's say this person's more of a morning person, I came in the afternoon after a day of activities, they're tired, they're not focused, they really may not do as well. Or vice versa, someone's more of an afternoon person, they'd rather sleep all day, and then we try to get them up if we come early and they're still sleeping, and that's a challenge too. And so it's very unique what I do, because that's why I have a very limited amount of patients I see per day, because I take my time. I have to take my time. I don't work based on time. I work based on basically getting through and getting as much as I can done while I'm there, but it's not really a set schedule, I can say, because a lot of the time I need much more time just to actually get the tool in the mouth and let it touch the tooth and then start doing something with it. Versus like when you go to the clinic, you expect to get it done right away. It doesn't happen that way. So it is a unique thing that I do, because I do factor in so many issues. And also if someone is already sort of unhappy that day for whatever reason, if the staff is a newer one too, and we try to get things going, all of a sudden the energy gets even more negative, and that just it snowballs. So there are a few issues there that are very difficult to fix, but I'm learning along the way, and hopefully down the road I can offer even more information to prepare each person before walking in. But again, the first appointment, I never know who I'm really meeting and what I'm walking into. So that's usually like the main assessment appointment. And then we go from there and we see what they need, and then we make the modifications. So these are the
Well,
challenges.
I've definitely seen you in action many times, and it's definitely not a regular, dental appointment like that you would expect in a clinic. I
Yeah.
personally have worked with you on an individual, and it's so important to be working, especially with people on the spectrum. It's so important to be working within their environment. And I've, worked with you while we were doing like a little dental checkup on somebody who was riding their tricycle in the backyard. So it's, it's just you're so great at actually like working with the individuals in their environment. So that's excellent.
Yeah.
And like routine and consistency across staff is so important. And routine and consistency in the lives of the individuals we support is so important. It's definitely important for the team to be prepared for your visit, to ensure that the individuals are aware what's going on, what to expect. And I think communication between staff, is also really important.
Absolutely.
Speaking of staff, what
Mhm.
would you suggest to get staff more engaged in dental hygiene?
So I do plan on creating some online training sessions so that even if it's a video that staff can watch and sort of learn techniques on the how to assist with someone's oral daily hygiene when you're supporting them on a day-to-day basis. It's so important to be able to do this regularly, because the mouth is a part of the entire body. For many years, it was looked at as a separate entity. But the last 10 years, I can say that the dental industry, especially, they're really wanting to collaborate more with other providers, medical doctors, more of that interdisciplinary collaboration, because it's not separate from the body. And so let's say, hypothetically, someone is having dental pain and they cannot verbalize it. They can't tell you that their teeth hurt or their gums are sore. So there's something going on. They cannot say what it is. And the only way to really know if something's happening in the mouth, sometimes, oh, there's a few ways, but for the person supporting, if they're actually trying to help them clean their teeth and brush their, around their gums, if they are kind of flinching while that's being done, that's a possible indication that there's something going on in the mouth. And so that's like an initial screening tool you can do if you're assisting someone every day, even if it's different staff coming in. Like if someone notices, yeah, I can't, they're hurting, you know, and the more you do it, they get used to it. But the problem is if there's pain, they're never going to want you to do it. So
Right.
that's a good sign that you can say, okay, I think there's something going on. There's an unmet need here and we need to investigate further. Now, the only way to really know if something is going on is to be assessed by a provider. So a lot of the time when pain is happening with someone and they cannot say what it is, people assume maybe headache, stomach ache. Oh, you don't know though. So you get a doctor in. And sometimes the doctor will say, you know what, I think maybe they need to be assessed by a dentist. So that's where we talk about the collaboration, starting off with the doctor, nurse practitioner, whoever you have access to, and then yes, dental dentist, a dental hygienist. So of course, when they have behaviors, it's hard to take them to a clinic. And this is why I started doing what I'm doing. And I do work with a dentist partner who comes with me to do the checkup and the exam. So at least we can get like a for sure answer of what's going on, because legally dental hygienists cannot diagnose. So I am trained to recognize things and I can say, yes, I do think you need to go to a clinic. There's a problem here. I can't legally say if it's a cavity or not. And so it's still, I mean, hygienists are still very valuable because we do the preventative procedures, and that's important too, to remove the buildup, because even if something is going on already, it does need to get treated. At least if the hygienist is cleaning off whatever's causing the problem. So like, you know, the buildup, the plaque, the bacteria that's there, that is the first step to kind of getting them to go, and then they can go get everything else taken care of at the clinic. So this is how staff can get more engaged. Like, and I get that, you know, dental is not the, as I was saying, it's been looked at as a separate entity. It's been prioritized very low on the list of needs in general. And I think it's starting to change now. They're finding direct links with oral health and the rest of the body. There's cardiovascular links, there's diabetic links, there's even links in pregnancy issues if things are left untreated. And so it's just so important to start understanding that the mouth, they say, is the window to the body, of the health of the body. And if you can start focusing on that every day, then, you know, you're taking care of the entire body. And yeah, that's how staff can get more engaged. Just, I know it's not easy, but if they're shown with a video of what to do, where to focus on the brushing in the mouth, what's important, instead of just doing like certain areas, because I do see that too. Sometimes people are brushing their teeth, but they're not really massaging the gums. And that's so important. You have to massage the gums with your toothbrush. So these are pointers I can give to staff.
Oh, that's great. And you know, it's important to realize that a lot of the time, you know, we are the main caretakers for these individuals. And so we have to, you know, not only keep them happy, but it's really important to keep them healthy. And it's just really, I think what the main thing is just the advocacy on part of the staff. Um, how do you, like, what do you think, what do you think is the most important part of advocacy, or why do you think advocacy is so important for the staff? I mean, I think that, you know, it can be quite obvious, but in particular with, you know, dental health, when you're working with these types of individuals.
Okay, so especially the ones that are nonverbal, they cannot communicate. They virtually, it's sad but true, they don't have a voice. And so you know, I would love, I wish everyone can just kind of put a picture in their mind of, just imagine a scenario where, let's say you or a family member that you really care about, they're, you know, living a regular life, and then one day they have a dramatic life altering illness or accident, and everything changes, and you now all of a sudden need 24-hour care. You don't have the ability to communicate your needs if you have pain. And let's say your only option now is living in a group home setting or congregate living, because you do need that 24-hour care. So you're relying on someone who's hired, people who are hired to come in and out of your home to ensure you get bathed, to ensure you get dressed, your teeth brushed, fed, medications are taken. And you cannot verbalize if you have upset stomach, a headache, to sensitivity or pain. So the pain can go on for months, and then eventually it can go on for years, and nobody around you knows that you're in this pain, and you can't say it. And then it becomes so aggravating to the point where you feel so frustrated that you start to hurt yourself because you can't say I'm in pain. Then it gets to the point where you may start hurting others because they still don't understand why you're hurting yourself. And so it's just sort of this snowball effect that can happen because somebody can't say that they're in pain. And then it gets to a point maybe where you start screaming on the top of your lungs because you're in that much agony. And then it results in a trip to the ER, which really didn't have to happen if
Right.
you were assessed by a healthcare professional, dental healthcare professional. So, I want to ask that question to everyone who goes into the field, who helps people who are so vulnerable, who rely on your support every day. Why is it so important for staff advocacy to see that there's a need there? It's because people need a voice. Everybody needs a voice. And so I ran into instances where some of the people I have seen, they exhibiting these behaviors, a lot of different sounds coming out, and self-injury or sometimes hurting others. And a psychiatrist gets called in to look at their behaviors, and they're trying to control their behaviors, but unfortunately, not maybe knowing that the person was experiencing pain. And in some cases it was dental. And so when we came in, we said, this person does need to go to a clinic and needs to go to sleep, take x-rays, have a baseline where they can do all the treatment if they find anything and they're cleaning. And then it's easier for us to help maintain things and catch things early from there on as things arise, because it's possible it will. It's hard to clean someone else's teeth. I get that. And so then they had a bunch of, one person had, actually it's happened to two so far that I can clearly remember. Teeth were pulled, lots of fillings. And then after that, things dramatically calmed down with their behavior. And then, everybody was pretty surprised, almost shocked. They were upset because they said, he was taking so many medications and they couldn't figure it out. And they felt really bad. And that's not what he needed. He needed a dental appointment. So
Yeah, I think
that's it.
sorry, no, I think that's why that everyone has to, think about, the biopsychosocial model, and really think of a holistic view of care for the individuals you support. And that's why we're, again, so very lucky to have the ability to get you to come in and, be in their environment and do that preventative work. So, well, that's awesome. That's all I have for today. So thank you so much for being here. I hope you're able to come in again. I know that we want to plan to do another webinar where you're able to, or an interview or webinar, where you're able to show some of the sort of techniques and strategies that you use with the individuals that we support. So again, thanks again. We're so lucky to be able to utilize you within Community Living Toronto, and the work you do is so important, and I know has helped so many. So thank you very much for everything.
Thank you. I feel lucky that I've been able to experience so much because I haven't been, we're not trained in school to treat people with special needs, with behaviors too. And so again,
Right.
there's still a very huge gap, a tiny bit of it. And I hope down the road it changes and that more providers do get more involved. There's a lot of changes that do need to be made though, in other areas, and it really should be deemed a specialty, just like they have pedodontics for kids and they even have geriatrics.
Yeah.
The only place that deemed special needs a specialty was Mount Sinai Hospital. That is it. I mean, it's not a specialty in the industry, and that's one of the issues. So we'll see what happens down the road, but I'm really happy to be a part of Community Living organization. And I thank you so much for having me here today. I'm glad that we can share this information.
Thank you, Josie.
Thank you.